Don't forget to subscribe and to click on notification bell so that you don't miss out any upload.
Hello everyone, this is Vet Sanon from MS Veterinary Services, where we offer dedicated expert care for all your animals' needs. You're most welcome to this platform, and we are going to talk about pink eye. Pink eye is also referred to as Keratoconjunctivitis, and here we are going to talk about its etiology, the mode of transmission, methods of spread, the clinical signs, stages involved in the disease. We shall also talk about the preventive and treatment measures of the disease. So stay tuned, all are here. Pink eye is a painful, debilitating condition which can severely affect animal productivity. Its mode of transmission is direct contact between infected and uninfected animals. What could predispose an animal to pink eye? And here are the predisposers of pink eye to an animal. They include flies, bright sunlight, dust conditions, and then physical irritation of the eye. Pink eye outbreaks are more frequently seen during the dry season when flies are so prevalent and then the ultraviolet radiation is high. And this coincides with the time when dry mature cysts are at most, as well as the dust conditions. Physical attributes of some animals make them more susceptible to pink eye than others. For example, animals with unpigmented eyelids and protruding eyes are more susceptible to physical damage and hence prone to pink eye, while animals with a hooded eye conformation, this offers them some protection from sunlight and physical damage, and this makes them less susceptible to pink eye. Method of spread of pink eye. A farmer may ask, why does pink eye normally occur in my herd almost every year? Here is the answer. Pink eye may persist in a herd in the eye of carrier animals which do not show any sign of disease. And now, the eye irritation from dust, bright sunlight, thistles, and long grasses may cause lacrimation, which is tear production, and this attracts flies. Then the flies feed on these secretions and move from animal to animal, spreading the disease. Also, the secretions from the nose and the vagina of the carrier animals are also sources of infection. Note that. Here are the clinical signs of pink eye. The first one is squinting, where the animal closes part of its eye for a good vision. Then there is watery, swollen red eyes. Then also formation of new blood vessels. There is cloudiness in the white part of the eye. Also, in severe cases, there is wound-like ulcers in the eye. 3 stages involved in pink eye. And in the first stage, the first sign of pink eye is an animal with a runny eye. And in the first 2 days, the membranes of the eye become red and swollen. And this is where the disease pink eye derives its name. This is followed with a watery discharge, causing tear staining and hence a closed eye. One or both eyes of the animal may be infected. That one should be noted. It may affect only one, but it can also affect both. But majorly in goats, when it affects a single eye, normally it also affects the other, ending up both eyes being affected. So when treating, better you treat the two rather than going for one. Still in the first stage, the cornea becomes clouded or bluish, and then a small white spot appears in the center of the eye. But in the majority of the cases, the infection starts to resolve, leaving little or no permanent damage, and that is all with the first stage. Let's go to the next second stage of pink eye. The spot in the center of the eye continues to enlarge, especially in severe cases, and over the next 1 to 2 weeks, the cornea is eroded to form an ulcer that spreads and swells as a result of white blood cells and then blood vessels moving into the ulcer. And here I recommend treatment to be done as early as possible before the disease becoming severe. If the ulceration is severe, the cornea may rupture at this point, and once the gel-like fluid is lost from the center of the eyeball, the sightless eye then shrinks back into the eye socket, and here ends the second stage. In the third stage, most of the eye becomes red as blood vessels grow across the cornea, and then since this is the recovery stage, as recovery progresses, the blood vessels start to recede and the eye first becomes a clouded blue color before it clears up, and full recovery may take up about 3 to 5 weeks before it completely heals up after the initial infection. First and foremost, purchase animals from trusted sources, and then when transporting, avoid transportation stress, and when they arrive, quarantine these animals to avoid introduction of the disease into the existing herd. And then lastly, when managing, ensure you avoid stress of the animals, as stress increases the hormone cortisol, which lowers the immunity of the animal, hence making it more susceptible to pink eye. Treatment of pink eye, the following can be used: eye ointments. A sterile saline solution can be flushed into the eyes. Oxytetracycline eye drops can be given 3 times a day, and then intramuscular injection of long-acting oxytetracycline can help in pink eye, though it is costly as compared to eye ointments. And I advise not to use powders, as they can further irritate the eye. Subscribe for more uploads. Thank you for listening.